I'd also briefly, Madam President, like to come to the floor to discuss the proposed House Medicaid changes that are part of what they are proposing to the Affordable Care Act. This is so important because, as many people know, Medicaid has been a bedrock of how individuals get access to health care in our country. And many parts of our state, at least the state of Washington, Medicaid has been a lifeline in rural communities, in urban areas, and we've heard much from various people that it is actually helping stabilize healthcare costs so they're not rising as fast, and giving people access to care in the most serious situations where we are trying to fight opioids or try to fight more efficiency in our healthcare system. So, first of all, I think the House bill is literally a war on Medicaid. I say that because it is a capitation of healthcare costs. The federal government, according to one budget analyst, the Center on Budget and Policy Priorities, the federal government would shift the cost to the states by more than $500 billion over the next 10 years. That would mean that millions of people would lose coverage and be affected by this kind of repeal. Now, many people talked about they might block grant Medicaid. I also thought that was a horrible idea because really it just becomes nothing but a budget mechanism to reduce the federal partnership that exists between the federal government and the states on Medicaid. But the House chose not to do exactly block granting. They said instead that we are just going to have a budget cap at the federal level on how much money they're going to spend on Medicaid and then work towards the repeal of the Medicaid expansion. This is a very bad idea. The actual per capita cut, I know my colleagues like to come out here and talk about a patient-centered relationship, which is exactly what getting off of fee-for-service and going to managed care does. But a per capita cost is nothing but a budget mechanism to cap the federal responsibility to Medicaid and cut costs, and basically shift the pain onto states. I've been on various meeting tours in the state of Washington talking to my constituents about this. In Seattle, Spokane, and Olympia, I met with hospitals, communities, clinics, women's health, local government officials, civic leaders, civil rights organizations, and I heard many things. I basically heard hospitals say there's evidence that Medicaid is actually lowering the commercial insurance premiums because of less uncompensated care. And I heard a safety net hospital in Spokane tell me that the population is already 70% Medicaid, Medicare, and that there is no way that they could absorb this kind of a cut to a Medicaid program and would just mean healthcare costs would rise in the future. And I heard a hospital in Seattle tell me that this kind of attempt is nothing but a budget trigger. It is not reform of the system. It is simply a way to cut the budget. And what we believe is that Medicaid is a key part of our healthcare delivery system. The expansion has worked well, and that we should continue to move to ways to innovate in Medicaid as a way to save costs. Unfortunately, right now, many people misunderstand how important Medicaid is in the mental health and addiction area. Basically, when you take what we've tried to do to address the opioid epidemic, those individuals who are working through the bills that we just recently passed to try to become patients in an emergency room or psychiatric care, or trying to deal with this grave problem we have in the United States, getting rid of Medicaid for those individuals, you might as well roll back all the assistance that we just provided as part of the cures and other legislation. Why? Because these individuals will not be able to access the type of care that they need without this support. So I do believe that what we need to do is innovate instead. There are many examples of innovation in our healthcare delivery system. One example, as I've mentioned on the floor several times, is going from nursing home care to community-based care. Medicaid is going to equal long-term care. So many Americans are not going to be ready to deal with their long-term health care issues. And when they're not, they're going to use Medicaid for their long-term care. We showed in the state of Washington over more than a decade period of time that we could save $2.7 billion by shifting our Medicaid population to community-based care instead of nursing home care. If we would do that same kind of innovation at the federal level, we would save more than this $500 billion that's being talked about right now as far as our costs. The issue here is that innovation in our delivery system, not a budget cap. Innovation, not a budget cap, is what is going to help us with our healthcare needs for the future when it comes to the Medicaid population. So I urge my colleagues to speak loudly against this proposal to try to cap Medicaid, to try to shift the burden to states and local providers, to county governments, to jails, to all of those individuals who are going to see that population when and if they don't have Medicaid coverage, and instead work together on expanding the innovation in Medicaid and coming up with the savings that we need to take care and provide health insurance and coverage to so many Americans. So with that, Madam President, I yield the floor.